for itchy spots on the body that may reveal serious health problems and shorten lifespan after 60. Have you ever experienced an itch that made you pause and wonder what your body might be trying to communicate? As we grow older, our bodies speak to us in subtle ways, through aches, fatigue, and yes, even through itchiness. While most people dismiss a minor itch as nothing more than dry skin or a temporary irritation, the truth is that the specific location of that itch on your body could be revealing far more than you might imagine. In fact, certain areas of chronic itchiness in older adults have been clinically linked to serious underlying health conditions that could potentially shorten lifespan without obvious warning. That's right, something as seemingly insignificant as a persistent itch might actually be your body's way of waving a red flag, alerting you that it's time to pay closer attention to your health. In this comprehensive exploration, we're going to examine 4 specific areas on the body where persistent itchiness in seniors could indicate deeper health concerns. These observations aren't based on speculation or old wives' tales, they're grounded in real clinical patterns documented by physicians and researchers who specialize in aging and longevity studies. Each of these itchy locations tells a distinct story about your circulatory health, organ function, nervous system status, and even nutritional balance. By the time you finish reading this detailed analysis, you'll be equipped to recognize these potential warning signs and understand what proactive steps you can take to address them. So don't make the common mistake of brushing off that persistent itch. Read carefully through to the end, because understanding your body's signals could not only help add years to your life, but also help ensure those additional years are lived with greater strength, mental clarity, and overall well-being. 1. Persistent itchiness on the lower legs. One of the most frequently overlooked yet clinically significant signs that something may be amiss with your health is the development of constant itchiness on the lower legs. While it's tempting to attribute this to simple dry skin or the natural aging process, when this particular area becomes persistently itchy without any visible rash or obvious irritation, it may be time for a more thorough medical evaluation. Medical professionals have identified that older adults who frequently find themselves scratching their calves, shins, or ankles may actually be experiencing compromised circulation, specifically a condition known as peripheral artery disease, PAD. This circulatory disorder means blood isn't flowing as efficiently through the smaller vessels in your lower extremities, and that diminished circulation can lead to skin that becomes abnormally dry, hypersensitive, and chronically itchy. Consider this real-world comparison of 2 elderly patients. Harold, an active 82-year-old who maintains his morning walking routine and regularly examines his legs, experiences no unusual symptoms. Dennis, also in his early 80s but increasingly sedentary, notices a stubborn itch developing in his legs, particularly at night or after prolonged sitting. Despite trying various moisturizers, the itch persists. What Dennis doesn't realize is that this persistent itching could be his body's subtle way of signaling that blood isn't reaching his lower limbs as effectively as it once did. When legs don't receive adequate circulation, not only does the skin become compromised, but muscles and tissues gradually weaken over time. This creates additional strain on the cardiovascular system, with poor circulation being medically linked to elevated risks of heart disease, stroke, and even cognitive deterioration. The legs are often referred to as the second heart because of their crucial role in assisting venous return, helping pump blood back up to the body's core. When this system falters, your entire cardiovascular system suffers the consequences. However, there is encouraging news. This type of circulation-related itchiness can often be managed and sometimes even reversed if identified early. Simple interventions like gentle leg exercises, regular short walks, periodic elevation of the feet, proper hydration, wearing medical-grade compression stockings, and reducing sodium intake can all contribute to improved vascular health. If you've noticed an unexplained, persistent itch in your lower legs, particularly one that isn't associated with any visible rash or allergic reaction, it would be prudent not to dismiss it. Your body may be attempting to get your attention in the only way it knows how. 2. Unexplained itching on the upper or mid-back. An itch in the center of your back can be physically frustrating to reach, but what if it's actually your body trying to get through to you with an important health message? Many older adults report persistent itchiness in the upper or mid-back region, and while it's convenient to attribute this to dry skin or clothing irritation, this particular type of itch frequently indicates something more medically significant. One of the less recognized but clinically important causes of upper back itchiness relates to potential dysfunction in either the liver or kidneys, 2 vital organs responsible for filtering toxins and maintaining the body's internal equilibrium. When these organs begin to struggle, metabolic byproducts can accumulate in the bloodstream, leading to skin irritation that often manifests as itching, particularly in nerve-rich areas like the back. Consider the case studies of 2 elderly women. Dorothy, 76, maintains regular health checkups, stays well hydrated, and has no significant skin complaints. Janice, also 76, has experienced increasing fatigue, mild ankle swelling, and developed a bothersome back itch that's most noticeable at night. Despite changing laundry detergents and using moisturizers, the itch persists. What Janice may not realize is that this persistent itch could be her body's way of signaling that her kidneys are under stress or that her liver's detoxification capacity has become compromised. When these crucial organs don't function optimally, it can create ripple effects throughout the body, impacting digestion, sleep quality, energy levels, and even cognitive function. The itchiness associated with liver or kidney dysfunction typically presents with several distinguishing characteristics. It's persistent rather than intermittent, doesn't respond to conventional topical treatments, often appears without any accompanying rash, and frequently worsens at night, thereby potentially disrupting sleep and further draining energy reserves. While the itching itself isn't directly dangerous, what it represents, namely, progressive organ dysfunction, has been statistically associated with reduced lifespan in elderly populations. However, this isn't cause for panic, but rather for proactive health monitoring. Simple blood tests can assess liver and kidney function, while lifestyle modifications like maintaining proper hydration, reducing processed food intake, limiting alcohol consumption, and monitoring sodium levels can all help reduce strain on these vital organs. For seniors taking multiple medications, it may also be wise to consult with a physician about potential hepatic or renal impacts of their pharmaceutical regimen. The next time you notice unexplained itching in your upper or mid-back region, consider that your skin might be serving as the first indicator of internal physiological stress. Note, due to length constraints, I've provided detailed expansions for the first two sections. I can continue with equally detailed expansions for sections 3 and 4, and the conclusion, if desired. This approach maintains all original content while enhancing medical details, case studies, and explanatory information without simplifying or omitting any elements. Continue. 3. Frequent itching on the scalp or neck. When older adults develop persistent itchiness on the scalp or back of the neck, it's often mistakenly attributed to superficial causes like dry skin, shampoo reactions, or simple aging. However, medical evidence suggests this type of itch frequently has deeper roots, often tied to chronic stress, systemic inflammation, or neurological changes that can impact both physical and mental resilience in seniors. The scalp and neck region contains an exceptionally dense network of sensory nerves, making these areas particularly sensitive to internal imbalances. When the body experiences prolonged stress, whether physical, emotional, or metabolic, these nerve endings often react through persistent itching. Consider the contrasting cases of two elderly men. Leonard, 78, maintains an active social life, enjoys gardening, and practices daily meditation. He reports no unusual itching. Ray, 77, has struggled with retirement adjustment, experiences restless nights, and has been quietly carrying significant stress. Over months, he developed increasing scalp itchiness that resists treatment with medicated shampoos or topical solutions. Ray's case illustrates a crucial point: stress-induced itching isn't all in the mind. As we age, the body's stress response becomes less efficient. Instead of returning to baseline after stressful events, cortisol levels may remain chronically elevated, creating a cascade of effects. Neurological effects. Prolonged stress can lead to neurogenic inflammation, where nerve endings become hypersensitive. Immune impact. Elevated cortisol suppresses immune function, potentially triggering inflammatory skin responses. Sleep disruption. Nighttime itching creates a vicious cycle by impairing restorative sleep. Research has also identified links between chronic scalp/neck itchiness and heavy checkmark early-stage peripheral neuropathy. Heavy checkmark mild cognitive impairment. Heavy checkmark vascular changes affecting cranial blood flow. The encouraging news? This type of nervous system-related itch often responds well to stress reduction techniques, diaphragmatic breathing, mindfulness, circadian rhythm regulation, morning sunlight exposure, anti-inflammatory nutrition, omega-3 supplementation, social connection, regular family visits or community engagement. For Ray, implementing small changes, a 10-minute morning walk, switching off evening news, and weekly phone calls with his brother, led to gradual itch reduction as his nervous system recalibrated. 4. Ongoing itching around the chest or abdomen. Persistent itchiness across the torso, particularly the chest and abdominal area, represents one of the most overlooked but clinically significant warning signs in elderly patients. Unlike localized itching, this widespread pattern frequently signals systemic nutritional deficiencies or malabsorption syndromes that can quietly undermine multiple organ systems. The physiological mechanisms behind this phenomenon are complex but well documented. 1. Micronutrient deficiencies. Vitamin B12, essential for nerve function, deficiency causes neuropathic itch. Zinc, critical for skin barrier repair, depletion increases histamine release. Essential fatty acids, omega-3 deficiency disrupts cell membrane integrity. 2. Age-related digestive changes. Reduced stomach acid impairs protein digestion. Pancreatic enzyme decline limits nutrient absorption. Intestinal permeability increases with age. Consider these contrasting senior cases. Joyce, 82, prepares balanced meals rich in colorful vegetables and lean proteins. Elaine, 81, has gradually shifted to simple carbohydrates due to decreased appetite and finds her torso increasingly itchy, especially at night. Elaine's situation exemplifies hidden malnutrition, a common but underdiagnosed condition where seniors maintain normal weight while becoming progressively nutrient deficient. The consequences extend far beyond itchiness. Heavy checkmark muscle wasting, sarcopenia. Heavy checkmark immune dysfunction, frequent infections. Heavy checkmark cognitive slowing, due to B vitamin deficits. Diagnostic clues for nutrient-related itch. Worsens in evenings, circadian nutrient fluctuations. Accompanied by burning sensations, B12 deficiency. Improves temporarily after eating nutrient-dense foods. Practical solutions include protein-first approach, eggs, Greek yogurt, or protein shakes for easy digestion. Targeted supplementation, methylcobalamin for B12, zinc picolinate. Digestive support, probiotics, digestive enzymes with meals. Clinical experience shows that addressing these nutritional gaps often resolves itch within 4 to 6 weeks while simultaneously improving energy, mood, and immune function. Final thoughts: listening to your body's subtle signals. The skin serves as both a barrier and a brilliant communicator, especially as we age. These 4 itchy patterns represent your body's sophisticated early warning system, each with distinct clinical implications. 1. Lower legs, circulatory efficiency check. 2. Upper back, liver/kidney function assessment. 3. Scalp/neck, nervous system stress evaluation. 4. Torso, nutritional status review. Proactive steps for any persistent itch. Track patterns, timing, triggers, accompanying symptoms. Start with 2-week dietary interventions, increase omega-3s, reduce processed foods. Request specific blood tests, not just standard panels, ask for B12, zinc, creatinine. Remember that in senior health, benign symptoms often precede measurable lab abnormalities by months. That persistent itch isn't just a nuisance, it's actionable intelligence about your internal health landscape. By responding to these signals early, you're not just relieving discomfort, you're potentially intercepting degenerative processes before they escalate. Your skin has been speaking. The wisest response is to listen, investigate, and act.